weeks ago, on March 25th, a researcher from the University of Massachusetts conducted an interesting survey. He reached out to 20 eminent epidemiologists and public health experts, and he asked a simple question. He asked, how many Americans will die from this outbreak of the coronavirus? The average estimate he got back was 245,000 people. As it happens, that number matched almost exactly the projection from the Institute for Health Metrics and Evaluation at the University of Washington, the group that has created the most influential model of the pandemic. As recently as yesterday, you heard some authorities cite those numbers effectively in public. Hundreds of thousands will die. Well, that estimate has changed dramatically. This morning, the IHME issued brand new numbers. Its researchers now project 60,000 deaths in this country by August 4th. That's 1/4 of the original projection. Numbers for individual states have changed as well. In Virginia, for example, which is currently suffering under a lockdown until June, the model now predicts a total of 891 deaths statewide. Just a week ago, the IHME projected 3,073 deaths in Virginia. That's more than 3 times what they're now saying. At this point, we should not be surprised that the model got it wrong. The IHME's prediction of how many hospital beds we'd need turned out to be completely disconnected from reality. And that matters quite a bit, it turns out, because those numbers were the main justification for this lockdown. Remember our efforts to flatten the curve? They weren't crazy. There was a good reason for doing that. We didn't want our healthcare system to collapse under a flood of new coronavirus patients. And so far, it has not collapsed. But not because we prepared effectively. We didn't really. There were just far fewer people who needed inpatient medical treatment than we thought there would be. For example, the model predicted that on April 4th, New York would need 65,000 hospital beds. The actual number was 16,000. Now, you're hearing people now say that the spread between the prediction and the reality must be due to social distancing. But that is not true. Social distancing measures were factored into the model from the beginning. The prediction turned out to be 4 times larger than what actually happened. Social distancing didn't do that. Something else skewed the numbers. We don't know what it is. We should find out. At the same time, though, the IHME has been far more accurate on death totals. In some cases, they've been significantly overstated, but not by 400%. Pretty close in a lot of cases. Today, as we told you, the IHME announced that about 60,000 Americans will die by the time the virus presumably recedes in the summer heat. That's an awful lot of people, but it's far from the largest death toll we will see this year. For perspective, we're going to read you now a series of numbers. Now, some people may be offended to hear this, but there's no reason to be. Accurate statistics are not offensive. They reflect reality, and reality should always be the baseline from which we make important decisions, even if we ourselves have made other predictions in the past, even if we're embarrassed to admit what we now know. We should do it anyway, because ego doesn't matter at a time like this. The truth matters. So here are a few numbers. As we said, an estimated 60,000 Americans will die from the coronavirus. According to the CDC, in 2018, 61,000 Americans died of the annual flu. That same year, more than 67,000 died from drug overdoses. Nearly 50,000 died from suicide. About 88,000 Americans died from alcohol abuse. 83,000 died from diabetes. More than 606,000 died from cancer. Can go on. But for now, let's look at 2 of those numbers, overdoses and suicides, both, by the way, disproportionately kill young people. Let's say the IHME death projections are too low for the sake of argument, and this would be the first time that's happened. But again, just for the sake of this exercise, let's assume the real number is twice as big. It's 120,000. That's how many Americans will die in this outbreak. If that's true, that would still be around as many people as die from overdoses and suicides, both of which our leaders essentially ignore. Deaths like those are not considered a government problem. Yet in the last several weeks, in order to protect ourselves from the Wuhan coronavirus, which is dangerous and scary, we have thrown an estimated 17 million people out of work. We've spent more than $2 trillion in borrowed money, and that's just the response so far. Now, we're not going to tell you that what our leaders have done in the last month is disproportionate. You can decide that for yourself. But it's definitely something to think about going forward, because, again, reality matters. Even if it embarrasses us,